Hello, I'm Charles Blair. I've got a few tips for you on the fluoride coding. We actually have three fluoride codes. D1203 is for the child fluoride, D1204 is for the adult fluoride, and then D1206 is for both children and adults, but it specifically is fluoride varnish, and it is specifically for moderate to high caries risk. Now let me give you little facts about fluoride. Fluoride is typically paid either once a year or twice a year, and fluoride is usually paid up through age 18. So those are generalities. There may be other specifics of various policies. Now, the mistake that I see, and the takeaway here is, many offices, when they convert the child from a child prophy over to the adult prophy, they do not go ahead and convert the fluoride over to the 1204, to the adult fluoride code. They are fearful that's not covered. But you see, 1204 is generally covered. It is adult fluoride, but it's covered up through age 18, or up to age 18 generally. And so 1204 can have a little better reimbursement than 1203. So I would challenge you then, when you do switch over from a child prophy to an adult prophy, go ahead and report it correctly. Report the 1204 code in conjunction with the adult prophy. Now 1203 and 1204 are for low-risk patients, low caries risk patients. That means that they really have not had any cavities in the last couple years, they're not wearing braces, and so forth. The 1206 code is specifically for moderate to high caries risk patients. So we cannot use the 1206 code unless the patient has a history of caries and also could have some risk factors such as wearing braces, they have some erosion, they have extensive crown and bridge in the mouth, maybe some salivary problems. Those would all be candidates for the 1206 code. 1206 is fluoride varnish mandated, whereas 1203 and 1204 does not mention what type of fluoride to use. However, with 1203 and 1204, if you look at the ADA's evidence-based dentistry website, you'll find that really fluoride varnish now is the best type of fluoride to use. So, let me give an example of how this might work. Let's say that a parent brings in two children. Both kids receive fluoride varnish, so they have the identical treatment. However, one kid has a perfect mouth, no cavities. That particular child would be coded either 1203 or 1204 on the fluoride, depending on their prophy status. The other child has cavities all the time. They're going to be coded 1206, and so you can see the difference there of when we use 1206 versus the 1203 or the 1204. The bottom line of using 1206 is the reimbursement can be a little higher than the other fluoride codes, and so use the 1206 legitimately. It is specifically, again, 1206 is specific for fluoride varnish, and it is for adults or the child, and it is moderate to high caries risk.